Autism spectrum disorder, understanding autism in teens and adults, a training for healthcare workers. By the end of this training, you'll be able to define autism spectrum disorder, recognize signs and characteristics in teens and adults, identify sensory processing differences, improve communication with autistic individuals, differentiate meltdowns from tantrums, apply person-centered care techniques, and improve safety in healthcare options. Welcome everyone. Autism is often discussed in children, but today we will focus on adolescents and adults. So many adults remain undiagnosed or are diagnosed later in life. So understanding autism allows us to improve our communication, reduce misunderstandings, and provide the respectful, individualized care. So what is autism spectrum disorder? The word spectrum means autism looks different in every person. Some individuals need significant daily support while others live independently. They work full time, they attend college, or they have families. So communication, social interaction, behavior, learning styles, sensory processes. Again, autism is called a spectrum because every individual experiences it differently. Statistics. Although these statistics come from childhood surveillance, they help us to understand that many of these children become autistic adults. So increasing awareness has also led to more adults seeking evaluation later in life. Approximately 1 in 31 children in the United States is identified with autism. Many autistic adults remain undiagnosed due to changing diagnostic practices over the years. Autism occurs in every race, every ethnicity, every culture, and every socioeconomic group. Many autistic adults are employed, they do attend college, or live independently, while others require that ongoing support. These facts help dispel those common myths. Autism is a neurological difference, not something a person outgrows. So it's just not, it's not that easy. It is not mental. It is not caused by vaccines. Many autistic people have average or above average intelligence. Some individuals speak very little, while others are highly verbal. Many adults receive a diagnosis in their 20s, 30s, 40s, or later. Autism lasts throughout their life. Not every autistic person displays all these characteristics. Some individuals learn to mask or camouflage their traits, especially women and those diagnosed later in life. Some of those include difficulty understanding sarcasm, takes language literally, difficulty maintaining conversations. They tend to avoid eye contact. Not everyone. They prefer written communication. Some of the social interaction, they have difficulty making friends. They prefer routines, social exhaustion, difficulty understanding those social cues. That's why many of them don't like to be touched. Now let's talk about some behavioral characteristics. So behavior is communication. Instead of asking, what's wrong with this person? Maybe ask, what is this behavior trying to communicate? So possible causes will be pain, fear, hunger, anxiety, fatigue, sensory overload, change in a routine, because remember things have to be planned. They have to have a routine. Some of those characteristics. Now they like stemming things. It helps many autistic individuals regulate emotions, focus, or manage their sensory input. Unless the behavior is unsafe, it generally should not be discouraged. These characteristics include repetitive movements, rocking, hand flapping, finger tapping, repeating words, strong interest in specific topics, strict routines, and difficulty with unexpected changes. Sensory differences. So imagine hearing every word, every sound in the room at the same time. Everyday environments can become overwhelming. Simple adjustments can make a significant difference. Loud sounds, bright lights, clothing textures, certain food textures, strong smells, crowded environments. So meltdown versus tantrum. This distinction is important. A meltdown is not a bad behavior. It is an overwhelmed nervous system responding to excessive stress or sensory input. So a meltdown would be loss of control. This is usually triggered by overload, cannot simply just stop it, and they just need support. A tantrum is a goal-directed behavior because they want something. It seeks a desired outcome, usually stops when the goal is achieved, and they need guidance and appropriate limits. Communication tips for healthcare workers. Support begins with respect, so clear communication and patience often reduce anxiety and improve understanding. So those common things would speak clearly and calmly. Use simple, direct language. Give one instruction at a time. Don't overload them. Allow extra time to process things. Explain procedures before touching them. Avoid sarcasm or figurative language. Respect communication devices. And some of those examples of figurative language, expressions like you're feeling under the weather or bite the bullet. Things like, I'm so hungry I can eat a horse. Like, that's figurative language because they interpret it just as what you say. So you just have to be careful with, words and sayings like that. Providing safe, respectful care. Remember to explain and ask permission before touching. Many autistic individuals report negative healthcare experiences because providers move too quickly or they don't explain the procedures. Explain every procedure, encourage their independence. They like to do things on their own. Offer choices, reduce unnecessary sensory input. Respect their personal space. Respect their personal routines. Offer them privacy. Let's talk about some of these myths. Myths versus facts. Autism is caused by vaccines. I have heard this countless of times. This is a myth. This is not a proven fact. Scientific research has found no credible evidence linking vaccines to autism. Another myth. Autistic people lack emotions. Autistic people experience emotions deeply, but may express them differently. Another myth. Everyone with autism has the same abilities. That is a myth. That is not a fact. Autism is a spectrum and support needs vary widely. So let's review and discuss. So here we have a case study. Patient's name is James. He's 19. James arrives at an outpatient clinic for routine blood work. His mother tells the nurse that he is autistic and becomes very anxious during medical procedures. When the phlebotomist calls his name, James begins pacing in the waiting room. He covers his ears when he hears other patients talking and equipment beeping. He avoids contact and repeats, I don't want it, several times. One staff member comments, he's being difficult, while another suggests holding him down so blood can be drawn to be quickly. James' mother explains that he understands what is happening but needs extra time to process information and becomes overwhelmed by loud noises, unexpected touch, and changes in routines. So some discussion questions. What behaviors suggest James is becoming overwhelmed rather than being non-compliant? what environmental factors may be contributing to his distress. So some of those possible answers could be covering his ears, pacing, repeating phrases. He said, I don't want it, I don't want it. Some of those triggers are the possible triggers. Loud conversations. Remember, they can't get overstimulated. So loud conversations, hearing this and hearing that in the waiting room, medical equipment alarms, bright fluorescent lights, crowded waiting rooms. These are just some possible triggers that could be affecting James. And then we could do another one. Which staff actions may have unintentionally increased his anxiety? Well, talking over one another, touching James without permission, labeling him as difficult, rushing the procedure. They want to hold him down instead of giving him that time to process it. So let's review, and we're going to test your knowledge. So the first one is a true or false. Autism is a lifelong condition. That is true. Scenario number 2. Which communication strategy is most helpful? Is it A, use sarcasm, B, give clear, direct instructions, C, speak rapidly, D, avoid explanations? And the answer is B. So if you answered B, then you are correct. Give clear, direct instructions. And number 3, true or false. A meltdown is the same as a tantrum. True or false? That is false. They are not the same. Well, very good. Understanding autism is not about changing the individual. It is about changing our approach to their care. Every interaction is an opportunity to create a safe, respectful, and supportive healthcare experience for them. Every autistic individual is unique. Communication differences are not deficits. Behavior often communicates an unmet need. Respect sensory differences. Build trust through patience, flexibility, and empathy. Person-centered care improves health outcomes and quality of life. Now, I know some of you may be thinking, I don't work with patients who have autism, but the truth is you probably do, even if you don't realize it. Not every autistic person has obvious signs, and not everyone shares their diagnosis. Many autistic teens and adults attend school. They work, they shop, they worship, they travel, they receive healthcare, they do everything just like, everyone else does. But as healthcare workers and caregivers, we have a unique responsibility, whether we're caring for a patient at a clinic, assisting someone in a long-term facility, or talking with a coworker, assisting them at their home, or interacting with someone with their family. We have to understand that autism helps us communicate more effectively. This training of autism helps us communicate more effectively, and so that we can respond with compassion instead of judgment. This training is about more than just autism. It's about learning to see the person first instead of the diagnosis. So I hope this has been helpful to you. Thank you so much for your time, and until next time, have a wonderful evening.